Hello everyone, my name is Ming-Lei, and I'd like to thank the Journal of Magnetic Resonance Imaging for giving me this opportunity to present our study titled Myocardial MRI Cine Radiomics, a novel approach to risk stratification for major adverse cardiovascular events in patients with ST elevation myocardial infarction. Here is some information about our co-authors and grant funding. First of all, what is myocardial infarction? According to the fourth universal definition of myocardial infarction published in Circulation, MI is defined as myocardial cell death caused by prolonged ischemia. It is typically classified into ST elevation MI and non-ST MI based on clinical symptoms and ECG results. Background. Over the past decades, STEMI survival rates have significantly improved, primarily due to timely PCI. However, despite these advancements, some patients still experience adverse outcomes, such as heart failure, reinfarction, and cardiac death. MVO, IMH, and LGE have been identified as independent predictors of MACE in STEMI patients. Additionally, radiomics has introduced a new perspective for prediction and prognosis in the cardiovascular field. However, the added prognostic value of integrating myocardial radiomics into MACE risk assessment in STMI patients remains uncertain. Our goal is to determine whether myocardial radiomics can improve risk assessment for MACE when combined with clinical data and CMR parameters in STMI patients. We also aim to develop a new risk stratification method for better clinical management and to reduce over-treatment. Study design. We followed the below steps: collection of clinical data, obtaining of radiomic features, assessment of prognostic value, and last, establish a new risk stratification. For the cohort results, there are 819 patients included in training set and 205 in testing set. Here is a comparison of the baseline characteristics. We can see that there are significant differences in LVEF, LGE, MVO, IMH, and others. As for the selection of radiomic features, the top 5 significant features were filtered through elimination of redundant ones, correlation coefficient more than 0.9, and loss of regression. After that, logistic regression has been used to obtain RAT score, which represents the integrated impact of features to MACE. It's obvious that there are significant differences of the distribution of these features and RAT score between groups of MACE positive and negative. The heat map showed that the correlation between features and CMR parameters was low, which partly reflected the potential prognostic value of radiomics analysis. Based on the results of our models, we identified 4 independent parameters for MACE risk: CLIP class greater than 1, diabetes, LGE, RAT score. KM plot showed the patients with a RAT score greater than minus 1.66 had a significantly higher likelihood of experiencing MACE compared to those with a RAT score of minus 1.66 or lower. In the training set, we compared the C-index, NRI, RDI, and all the p-values were less than 0.05, indicating that adding RAT score improved the performance of these models. And also, the AUC values were increased through the time-independent plot, which were aligned with the results of formal table. Furtherly, it can be observed that after the inclusion of radiomic features, the model performance improved in the test set and the difference was significant. Compared to a strategy based solely on LVEF, less than 40%, this clinical risk stratification reclassified MACE risk in 33% of patients in the training set and 34% in the testing set. Limitation. This study's retrospective design may introduce selection bias, so our results need prospective validation in larger, multicenter cohorts to confirm their generalizability. Radiomics analysis requires high-quality imaging and advanced computational resource, which could limit its broader clinical adoption. Additionally, due to resource constraints, we couldn't perform an extensive reproducibility evaluation. Variations in scanners and imaging protocols may also lead to imaging heterogeneity. Conclusion. Myocardial Cine radiomics are associated with MACE risk in STEMI patients. When combined with traditional parameters, myocardial Cine radiomics provide incremental improvements in risk stratification. High-risk patients identified by this strategy may benefit from closer monitoring and personalized interventions, while low-risk patients can avoid unnecessary treatments and follow-up can be appropriately prolonged. Thanks for your attention.